welcome everybody. I hope you will gain something tonight. First of all, it's science-based. Everything is based on testing and science. It's personalized. In other words, there's no one size fits all. It's individualized. We understand the process of each person, what they need, and it's an individualized approach. And very important is a trend, which is becoming more of a trend in conventional medicine, is compartmentalizing medicine. So you'll go to your hepatologist for a liver problem, you'll go to the cardiologist for a heart problem, and a gastroenterologist for your intestinal problem. But the truth is the body is highly interconnected, and there's a lot of messaging from all systems. And it's very important when you get a heart problem to look at the whole gamut of things that can affect the vascular system. And the same with the brain. Brain's linked very much with the gut, and the kidneys are linked with the heart. So all these systems are interlinked, and what we do is we look at the systems together and look at the interconnection, which is a very vital part of getting an understanding of what's going on. Let's see the next slide. So our approach in the Be Young Clinic, first of all, obviously we get a very, very detailed history, and we do extensive testing so that we understand where the person's coming from and what's going on with the person. We use sophisticated labs. Some of them we send to the States that can't even be done in Israel. And then we will work on a personalized plan for the patient. Now, bear in mind, and this is part of, or maybe the main essence of my new book, the main issue in that book is that we have a new pyramid of health. And the new pyramid of health is a little bit different from the usual pyramid. The base of the pyramid is what we call value and purpose. And the first thing we look at for everyone is that life is purposeful and has value. Second step on the pyramid is that we look at emotional and social health, because it's very crucial, and this we'll see later on, in terms of brain health, it's very, very crucial to make sure that we are socially connected and emotionally intact and well. And then we'll go on to nutrition and exercise and other factors that are on the usual health pyramids. Now, can I get the next slide? When we talk about the brain, it's a very fascinating organ. It weighs only about 3 pounds, but it uses 20 to 25% of the body's energy. It's an extremely active organ. And if you look at a diagram of the blood flow to the different organs, you'll see that the majority of blood, the biggest percentage of blood, goes to the brain. The brain is made up of billions of neurons, of nerve cells, and there are trillions of connections. So every brain cell has little arms going out from it called dendrites, and those dendrites are communicating with other cells and sending out messages, trillions of messages at all times. So you can imagine this organ is doing multiple tasks at any one time: listening, hearing, feeling, thinking, a massive, massive amount of functionality. Now, it's amazing. If you would go to a medical congress and speak about the brain of this amazing organ, everyone's going to talk about the evolution of the brain, which took billions of years, and it evolved like this. I think in this audience, I can say this is not evolved. This is a created organ, which is so sophisticated that it's beyond evolution. There are 3 main parts of the brain: the cerebrum, which is our thinking part; the cerebellum, which is balance and orientation; and the brainstem right at the bottom of the brain, which is all the functionality of the body in terms of the pulse and the breathing and other functionalities. Now, it's interesting that we used to think that you're born with a certain amount of brain cells and you cannot produce any more. And as you get older, there's destruction of brain cells to the point of you get to a certain point where you start getting cognitive decline. And that is an old theory, because the new theory is that brain cells can be regenerated. And it's a very important thing, that we're not born with a set amount of brain cells that degenerate with time, but brain cells can be regenerated. So we have different parts of the brain. The front part, the prefrontal cortex, is for thinking. The hippocampus is a little center in the brain called the hippocampus. That's our memory center, very, very crucial. Our emotions are a place called the amygdala, that's near the hippocampus. Movement is from the motor cortex and the cerebellum at the base of the brain. And the brainstem right at the bottom keeps all our functioning in the body going. So very complicated and complex, and we need to keep this organ in good shape. So next slide. So now we get on to cognitive impairment. What goes wrong with the brain? So the first and most significant illness or compromise of the brain is called Alzheimer's disease. And that makes up the biggest percentage of cognitive decline, which is about 60 to 70% of brain problems is due to Alzheimer's. And we diagnose Alzheimer's by the buildup of two proteins. One's called amyloid, and the other one is called tau protein. And in the old days, you could only diagnose this after a person passes away. On an autopsy, you could say, well, there's a lot of amyloid in the brain, and it must have been Alzheimer's. Now, today, there's a blood test that can diagnose amyloid, and certainly on specialized MRI tests of the brain, you can see buildup of amyloid. The second most common one is called vascular dementia, whereby we have damage to the blood vessels. So we know that if you get a clot in a large vessel, one gets a stroke. That's a CVA, and that's a large vessel. But the multiple small vessels, the micro vessels in the brain, also can be damaged. And when one has got an unhealthy vascular system, and those little vessels are clotting all over different parts of the brain, and you can see that on an MRI, that's called vascular dementia. And it's a common dementia. Makes up about 15%. And we did a talk. The previous talk we did was on vascular health, because it's very important in terms of all types of longevity and functionality to make sure our vascular system remains healthy. So we gave techniques and an understanding of how to keep the blood vessels healthy, which is very crucial. Then there are less frequent types, which are devastating types of dementia, Lewy body dementia, frontotemporal dementia. There's a dementia with Parkinson's, normal pressure hydrocephalus, and Creutzfeldt-Jakob disease. But the most common, as we mentioned, is Alzheimer's and vascular. And that's we will concentrate a little bit on those two types of dementia. Now, it's interesting that the big pharmaceutical companies obviously are trying to find a cure for Alzheimer's. And what they're trying to do with many, many billions of dollars and a lot of hours of work is to break down amyloid, because amyloid is a protein that builds up in the brain which appears to be causing damage. So there are drugs that can do that, and we now have certain drugs, even FDA approved, that can be used, which break up amyloid, and they're even in use right now. The bottom line is there's not much improvement in cognition. It doesn't really work as yet. There are others in the pipeline which hopefully will be more useful, but right now all the drugs that break up this amyloid protein do not work, and they actually cause bleeding, and they have certain dangers related to them. And the reason is, as far as we are concerned in functional medicine, and I think it's correct, that when you have insults to the brain protects itself by making amyloid. So when you try and break up this protein, which is really protecting the rest of the brain, you're actually going to cause more damage. And that's one of the reasons why there's bleeding when you use these new drugs, because it's like when a wound forms a scab. That's there to protect and heal. Now, if you pull off the scab, you're going to start bleeding. So it's a wrong concept, and right now I hope it improves, but we do not go along with that process of trying to heal Alzheimer's. Next slide. So it's very, very common. Alzheimer's affects about 55 million people worldwide. Affects memory, cognition, language, behavior. And it is crucial that we get to grips with how to deal with this. Let's see the next slide. So if you see here a graph in the 2020, 2025, this is worldwide cases. You're looking on the vertical line, you're looking at about 60 million cases, and we're looking at in 2050 at about 140 million cases if the world goes in the way we're going. Now, it's very interesting that there's certain countries in the world, certain places in the world, I think you may have heard this, that are called the blue zones. And the blue zones, the investigators have been out to the blue zones to see what's going on there. And these centers in the world, small communities, they don't know what Alzheimer's is. They don't know what heart disease is. They don't know what chronic illness is. Most of the residents there live to 100 plus. They get sick for a week or two and they die. And they've looked at the various factors, and we'll discuss a bit more. Why is this? And the reason is the way they live. It's the way they eat, the amount of walking they do. There's no stress. It's very social societies. They all have a spiritual aspect to them. So people have looked at the blue zones and seen what's the common denominator. Why don't people get Alzheimer's there? And it looks like our Western culture has a lot to do with what's happened with the causation of Alzheimer's. Let's see the next slide. So, what are the early warning signs of Alzheimer's? So first thing, one of them is facial blindness, which means that a guy comes up to you and is friendly as ever, as if he's known you your whole life, and you're friendly back to him, because it's nice and polite to be friendly, but you do not know who he is for anything. And you go and ask your wife or your partner, who was that? And then they say, oh, maybe I remember them. That's facial blindness. You forget the face. You don't recognize the face. Decreased reading comprehension and recall, whereby it becomes difficult to understand a piece of something to understand. Then there's slow cognition and poor clarity, short-term memory loss, forgetting appointments. You go to the cupboard and go and look for something, go to the kitchen, and you say, what did I come here for? And you don't remember what you came for. Vocabulary is a very frequent issue, whereby we're thinking of some type of word, but we don't remember it, so we try and make up words to cover up. So you could say, I don't even know too much, but gregarious. Who knows what gregarious means? What? Outgoing. But we don't remember that word gregarious. So we work around it. Very personable and sociable. So we start losing some of our vocabulary. We misplace items frequently, and we also lose our way quite often. We forget direction. We're not so good anymore with direction. So they're early signs, and they're very, very important to recognize. So sometimes it's subjective, whereby you see yourself, I'm not as sharp as I used to be. I'm looking for words. I'm losing words. I'm going to this place and I can't remember why. I'm not recognizing. We see it ourselves as subjective, but there's also objective. Where I have very frequently, the partner comes in and says, I'm worried. And the other partner, there's nothing wrong. Don't worry, there's nothing wrong. But there may well be something wrong. So we must take notice both of the subjective feeling where we notice ourselves, something's a little bit off and changing, and certainly the objective where someone else is saying maybe there's something's going wrong. So go to the next one. So this is a patient, obviously not the right name, we've substituted names. 75-year-old man recently made Aliyah. He had a successful department store chain, and he came on Aliyah with his wife Sarah into Ramat Beit Shemesh because of the large amount of English speakers and superior quality of life. So the kids, one's in Beersheba and one's in Haifa. They're sure they're going to see them, but it doesn't happen too often. And they don't have other relatives or friends in Ramat Beit Shemesh. They haven't found a shul that's suitable or a rabbi. Feel quite lonely, quite bored, not so much to do, trying to keep busy going to the makolet and snapping a little bit at each other. And Abraham swears that he hears perfectly, but Sarah doesn't think so. So what are the risk factors in this couple? There are quite a few risk factors. Other than the factors that we're going to look for in blood tests and more sophisticated tests. One is boredom, lack of use of the brain. Secondly, social isolation, lack of close contacts, lack of purpose. When he used to be at work, he got up with a mission. He had people to deal with, and he paid salaries, which made people feel good. And a very important one is hearing loss. That we should never, never ignore hearing loss, because where's my sister-in-law, Miriam? She keeps telling us, watch your hearing, because there's atrophy of the brain if you don't attend to hearing. That's very, very crucial. And it's one of the highest risk factors for dementia is hearing loss. So we've got to be very cautious with that. So next slide. It's quite interesting. The body is a very, very sophisticated and fascinating. Not a, it's a creation. So the first thing is there are different membranes in different parts of the body, and these membranes are 1 cell thick. So you're not going to see them with the naked eye. You'd have to have a very high-power microscope to see this 1 cell. Now, there are 3 important barriers. So the first one is in the gut, the gastrointestinal tract. Lining the gut is 1 cell thick. They're called epithelial cells, and they're very closely attached to each other, and they determine what is going to get digested into your body and what's going to be eliminated from your body. And that layer of cells has to be very healthy. And we have to make sure that our gut is healthy, because if we get the wrong things in, as you'll see from the different risk factors, it causes a cascade of problems right through the body. So the next one is the endothelial cell. When we look at the blood vessels, they have 1 single cell lining the inside of the blood vessels, and that cell layer of cells is very crucial that it's very healthy, because if it's not healthy, you're going to get cholesterol particles going into the subendothelial space, into the wall of the artery, and cause plaque buildup and blockage and all kinds of problems. So that's another crucial lining of 1 cell. And then the last one is called the blood-brain barrier. That's where our blood vessels join up with the brain. and there's a one-cell separation, and that blood-brain barrier also has to be very healthy. Otherwise, you're going to get things going into your brain that's not good for you. So we have to see how to keep all these single linings healthy. So let's look at the different causes of potential problems. Now again, in functional medicine, rather than looking at breaking up amyloid, we look at the causation. And some of the great physicians who designed the functional medicine programs have made a minimum of 36 what they call holes in the roof, leaks. And when there's leaks in the roof, it causes damage. And we can identify those 36 leaks, and we can patch them. And if we patch enough of them, people start getting better. So we find with functional medicine, especially in early dementia, if you start patching up all of these problems that are going wrong, people can get better. You can stop the progression of Alzheimer's, and you can even reverse it. So one of the things which is very crucial is chronic infections. Infections have a consequence not only where it's infected, but all over the body, because the whole immune system becomes activated, and it gets through to the brain, to these linings, causing damage. And when they become chronic, that's the real time that we get damage. So the first one is gum infections. We know that healthy gums is very, very crucial in terms of brain health, believe it or not. And one has to go to the dental hygienist and make sure you floss and make sure we're not building up unhealthy bacteria in the gums that can get through the blood system, through the blood-brain barrier. And we know in Alzheimer's that these particular bacteria have a high concentration from the gums in people with Alzheimer's. Sinus, chronic sinusitis is another area where people, it's sitting there quietly, and then you have a flare-up, but it doesn't go. You may use antibiotics, and then it flares up again. So these chronic sinusitis and gum infections, and very, very important, is chronic inflammation and infection in the gastrointestinal tract. When we don't have a healthy gastrointestinal tract, there's a direct communication from the gut to the brain, with the nerves, with the immune system, with the nerve system, from the gut to the brain. And if our gastrointestinal tract is not working well, our brain's not going to be working well. It's a definite situation. Mold. We can forget about, we can do everything we want, and there's a bit of mold in the room. Mold is a poison for the brain and can never be ignored. If you notice mold, you smell mold, you must get rid of it, because it's a simple thing but devastating for brain. Then there are other kinds of infections like Lyme disease. Stress. Stress is a excuse me, is a very big toxin for the brain. Particularly, we know that stress produces cortisol. Cortisol is the stress hormone, which if we stressed all the time and got high cortisol, that gets through to the brain and causes damage. And we know that when we're in a stressed state and it's prolonged stress, our brain stops working well. We start slowing down. Very, very crucial to deal with stress. Elevated glucose and insulin. So glucose and sugar is a poison for the brain. When the brain uses excess sugar to make energy, it causes damage to brain cells. And what the brain prefers to use for energy is healthy oils. So what we need to do is we have to change our energy source from sugars to healthy oils. And the ketones that get into the brain and power the energy for the brain is much more powerful and healthy for brain cells. Very, very important. There's a chemical called homocysteine that we check for in our program, which is a toxin for the brain. It's interesting, when we detoxify things in the body, and things have to be detoxified all the time. There are various pathways that break down and get rid of toxins. So even hormones, when we've got excess hormones, the body has to detoxify and get rid of them. A very important way of detoxifying is called methylation. And that methylation pathway gets rid of a lot of our toxins. One of the consequences, if we're not methylating well, is we build up a chemical called homocysteine. And homocysteine is very bad for vascular health. It damages our blood vessels, and it damages brain cells. So we check for that. As we mentioned before, leaky gut, when we get damage to the gut and that lining of the gut and things that should not get in through the gut epithelial cells, and they go through into the body, they set up an immune response, and that immune response affects the whole body, including the brain. So we've got to look for that, and we can even test for a leaky gut. Autoimmune diseases come many times from a leaky gut, because again, you're getting foreign particles getting into the body, setting up an immune response, and then that goes through and causes damage. We like to have in the gut what we call microbiome diversity. And we can check this these days. What we can do is we can look at what type of bacteria are living in our gut. There are billions. In fact, there are more bacteria living in our gastrointestinal tract than all the cells in our body. And those bacteria are not static. They're doing things. They're processing things. They're digesting. They're causing toxins, or they're causing healthy metabolites. And we can check what type of distribution of these billions of bacteria are living in us. And it's very important to get the right type of diversity. We see often with Alzheimer's that you get a few types, not many different diverse types of bacteria, healthy bacteria, but a few unhealthy types that are predominant, and it's not healthy, and we can repair that. We can repair the diversity of the microbiome. And then we look for toxins. The big ones are lead, mercury, cadmium, and arsenic, and we can detoxify because they poison the brain. So those are some of the things that we call are neurotoxic. They cause damage to the brain. Then on the other side of damage, we want to build brain. And as I mentioned before, we don't have a static number of brain cells. We can build brain cells, and we can build connection between, because the connections between cells are very crucial. So how do we do that? The first thing, nutrition is very, very crucial, which Shoshana will tell us a little bit about. There's certain essential minerals that we need, and we'll check for it: selenium, zinc, magnesium, and others. Certain vitamins are very essential, and certain healthy fats. Hormones are very, very crucial. In females, estrogen is we find particularly with menopause, when women go through menopause and they say, I've got a brain problem, I'm forgetting, I've got Alzheimer's. It's not Alzheimer's, it's a lack of estrogen. Estrogen is a crucial element to keep the brain working well. In our field of functional medicine, which is actually swinging back a lot, even into conventional medicine, our ladies going through menopause, we recommend to take hormones, natural hormones, because they're going to do a lot of good for many of the systems, and in particular for the brain. So that's a very important one. And males have what we call andropause. They also go through a type of menopause, not as obvious as menopause. It's more subtle, but males lose their hormone, which is testosterone. And we know that testosterone is very, very important for brain functionality, the quickness of the thinking of the brain, sharpness of the brain. A youngster of 23-year-old, his brain is moving quick, thinking quick. Part of it is because he's got a healthy level of testosterone. So we look at hormones. Thyroid is obviously a crucial hormone that we look at, and if we find thyroid deficiency, hypothyroid, you're going to have effect on the brain. And then there are various supplements that are very helpful and have proven benefit for brain health, which I'm not going to go into detail, but one's called Bacopa, one's called lion's mane, which is a mushroom. There's choline bitartrate, which is a type of amino acid which helps to build brain. So there's a magnesium, but it's called magnesium threonate. That's the one magnesium that gets into the brain through the blood-brain barrier, and is very, very healthy for brain. So we, other than looking at the toxic elements, we look at the trophic areas, the things that are good for brain, and make sure that we're not lacking what we need, and we will do a lot of good for our brains. Next slide. So how do we go about testing? So first of all, we want a hearing test. As we mentioned, very, very central, and right on the top of the risk factors is hearing. We want to do hormone testing, especially in the younger age groups, menopausal, andropausal age groups. We want to know where those hormones are lying. TSH is thyroid, cortisol, stress hormone. We do specialized testing. There's a test, the ZRT test for minerals, to see if we're lacking minerals and elements. We do vitamin testing. We do gastrointestinal testing, looking for leaky gut, looking for the different microbiome and diversity of the different bacteria. And we also look for chronic infections. So we test, we don't guess. We look what's going on, and everyone's different. We look what type of leak in the roof is going on, and we patch it up by doing the appropriate testing. And then obviously we do the general blood tests, chemistry, lipids, glucose, serology, autoimmune stuff, inflammation, and homocysteine. Right, the next slide. So our functional approach to healing the brain, as opposed to trying to find a drug that's going to break down amyloid, we're looking for causation. We're looking for the root causes. What is causing damage, and how can we stop it? And on the other hand, how can we build brain? So the first thing is we're looking at nutrition, very crucial, and Shoshana will mention more about that. We're looking at physical activity. We know people who are physically active, whether it's on a milder level or on a more severe level, that they're doing a lot of activity, even mild or less extreme stuff is helpful for the brain. Very crucial, and there's a lot of data to show that people who are physically active maintain a healthy brain. And often we're going to say, well, I'm limited. What can I do? My hip's hurting, my knees are hurting. We have excuses, and they're realistic excuses, and they're genuine excuses, but they're not excuses. There's no excuse. You have to go into water therapy, hydrotherapy. You have to get around the barriers. There's no way you cannot attend to your physical activity. We do the correct supplementation and vitamins, which are, again, individualized. We test what's lacking, and we tell each individual what you need, and we make sure they take it. We correct hormone imbalances. We do stress management. We don't allow stress, although life is very stressful, but there are ways to get around it and to manage it, and we don't ignore stress. We eliminate exposure to toxins, and if there are toxins already existing, we do detoxification. We do, as we mentioned, value medicine, meaning, purpose, spiritual fulfillment, because we know even from the blue zones, but we don't need to go to the blue zones, that without that, there's deterioration of brain functionality. And then we look at the specific metabolic problems whereby they need to be, whether it's the methylation problems or glucose problems, where we have to repair them specifically based on any person's individual profile. So that's our program. And now I'm going to call on Shoshana, who's our chief nurse and coach and manager and runs the whole program, to take on.
So first of all, I want to thank you all for coming. I want to thank you for your interest in this topic because it's essential. It's who we are. Our brain is everything to us. Without it, we lose our sense of self. We lose our connection to others, our memories. It's the essence of our personhood. So it's the most important topic, and it's something that really touches me kind of deep in my heart. Watching someone lose their memory and go through the disease of Alzheimer's is extremely painful. And it begins with the identified patient, who is the person that usually family members bring in and say, my husband, my wife, my brother, my sister, they're not who they used to be. They're just not who they used to be. They used to know everything, the scores, the Cubs, the Cardinals, which Daf Gemara, this Agadata was on, everything. They knew everything. And all of a sudden, they're like blank inside. They're a shell of who they used to be. And that loss for the family is a deep loss. It's very traumatic. I don't know if some of you, I see some nodding, so I'm sure some of you have lived through this. What happens is that the family is, first we have the identified patient, and the family feels this loss. And oftentimes the patient themselves feels this, I'm slipping away. I can't quite grasp what I want to say. Like Dr. Dinner mentioned, they speak around their words. They can't quite remember what they came to the kitchen for. They can't quite remember who that familiar face is in Best Market, but they don't exactly know their name, and it's extremely upsetting. As the disease takes hold in the body, they lose more and more of that sense of self. They slip away slowly. And the family becomes the identified patient. We're just taking care of the family and the fallout that happens when someone loses their sense of self. So we never want this to happen. And the best way I can describe this is with a story, right? We're Jewish, we do great, we love stories. So there was a recent book put out called Outlive by Dr. Peter Attias. It's a fantastic read. And he describes a dream he had. He's a Johns Hopkins researcher. That he's standing under a bridge with a basket trying to catch eggs that are being thrown off the bridge. And no matter where he goes, he can't quite catch the egg, or he catches it and it immediately breaks. And no matter how hard he tries and how fast he runs, he can't catch the falling eggs. And he can't stop these eggs from breaking. And I think that the idea of this story is so profound because we don't have to catch the eggs from breaking. We have to go up on the bridge and stop the person from throwing the eggs. That's the solution. So we got to get ahead of this. We got to get ahead of the problem. So I hope that all of you tonight will take this very, very seriously because, they say an ounce of prevention is worth a pound of cure. In this case, an ounce of prevention is worth 1,000,000 pounds of cure. Because once someone is far, far along in the timeline, in the pathology of Alzheimer's, it's extremely difficult to reverse that. So let's get ahead of it. Let's get ahead while our brains are still healthy and that we have the capacity to repair. How do we repair? This is a really good question. I wish I could tell you, buy my supplement and it will fix everything. It won't. It just won't. This is a multifactorial problem. It's multidisciplinary. It requires treatment from several different angles. We cannot just attack this from one side. It's not only about diet or exercise or stress. It's about a combination. It's about how all these factors play together inside of our body and the whole person that they create. So I'm going to touch on each one, but just so you know, just because one came first or second doesn't make it more or less important than any other factor. So the first one is diet. We are living in what they call an obesogenic environment. Our environment leads us to be sick and fat and nearly dead, and we have to fight that at every level. We need to look for a nutrient-dense diet that's rich in antioxidants and phytonutrients and things that build our cells, that make us strong, that build our body. We're not only eating for fuel, we're eating for nutrition. We want to remove all of those processed sugars, processed food. We want to make sure that our diet contains whole foods that are healthy for us, that our body needs. We want healthy fats. Fat is not a scary word. If you lived through the 80s, you think fat is a very scary word. It's not. It's not. It's good for you, and it helps your neurons to function well. So healthy fats like avocado, olive oil. We want to include lots of berries, flax seeds, coffee, nuts, things that build us up and give us lots of nutrition and help our cells function optimally. If you want your mitochondria, which are the little powerhouses of our cells, they're the CEOs. They tell everybody, you go here, you go there, you do this, break that down, take that out, take out the trash. So those little CEOs have to be fed, and they're fed with nutritious food. So your food is your medicine. Your food is your medicine, and it should be consumed as such. The next thing I want to touch on is exercise. Consistent physical activity. I'm going to say it again. Consistent physical activity. That means get up every day, walk every day, bear the weight of your body every day. We need aerobics, we need strength training, we need dancing, we need swimming, we need activity in our lives. Sitting in front of devices or technology is one of the most damaging things we can possibly do for extended periods of time. Our sedentary lifestyles are breaking our bodies, and they're breaking our brains. So we need to fight that and get moving. Stress. I don't know if any of you living here in Israel have had any stress lately. Have you had any stress? Okay, I haven't had any stress. Existential threats, things that are outside of our control. We can't change them. Maybe some of you work for the Mossad. I do not. We cannot change the fact that things are going to happen. Rockets are going to fall. The Arnona is going to be due. Baruch Hashem for simchas. We're going to make weddings and bar mitzvahs, and hopefully Meretz Hashem soon by all of us. That these things are wonderful things, but they create a lot of stress. We're not going to change that. All we're going to do is learn how to deal with it in our own lives. We're going to manage stress, what I like to call emotional first aid. Learn how to deal with sort of the ebb and flow of life. Don't let things sit with you. Let it go. Learn to let it go. Learn to flow through challenges. Call on your resilience. Call on the things that you've lived through. You have all lived through a nuclear attack potentially by Iran. You have resilience. You have tremendous resources. You need to dig deep. You need to find those things inside of yourself and use them to go forward. Okay, you can change. Okay, these are 3 just as important categories. The first one is sleep. The Houthis are trying to get us. They're trying to get us with our sleep, but we're not going to let them. Okay? 7 to 8 hours of consistent quality sleep every night. I can't tell you how often people come in and they tell me, they're like, yeah, I sleep great. Great. How long do you sleep for? 2 hours. It's great. It's not enough. It's not enough. Your brain has to repair. Your brain has to get rid of toxins. Your brain has to rest, rejuvenate those cells along with your body. Your body has to be allowed to repair itself. The best way to do that is sleep. Okay, the next one is connection. Now, I love to see all of you here. I see so many familiar faces that I know from the clinic and new people. And for sure, I'm sure if you see me in Best Market, you're, oh, yeah, it's always like, wait, I know you. From where? I'm like, oh, Dr. Dinner. Oh, right. It's always good to connect, to have those meaningful social connections, to build a community, to check on each other. If you don't hear from someone, call them, invite them, go for coffee, make a friend. Don't let people sit home alone. Don't let them sit home alone on Shabbos, Chagim. Go out there. Our community has a wealth of resources. We are the most resourced community in Israel. Do you know we house more non-government organizations than any single community, any single city in Israel? They need volunteers. I'm sure everyone has a skill. Even if it is folding a paper and stuffing an envelope, something you can do to help, to be a part of a team. It's essential. Reach out to your families. Offer to babysit. Babysit my kids. Whatever. I'll drop them off at 4. It's fine. So reach out to a neighbor. You see, you have a young mother and she's struggling. Sit on the couch and hold her baby for her. It's not simple. And they'll do the same for you. They'll do the same for you. We are all connected with each other. Okay, the next thing is to grow. We have to continue learning. This is a lifelong process. There is no cessation to learning in our lives. I'm going to say this because I actually went back to school this year. I have been a nurse for 19 years, and I decided that in all my years of nursing and my several degrees, I have a degree in psychology and a degree in nursing, that I never just learned how to be a psychotherapist. So I decided to go back to school this year to become a psychotherapist. And I bring that into my work in the clinic. It is the most important thing you will do for your brain is to continually stay stimulated, proactive, reading. We're talking about proactive engagement, not passive engagement. Passive engagement looks like opening your phone and scrolling as your eyes kind of glaze over and your husband's calling you from the other room and you're like, what? Don't let them steal your eyes. Active engagement in whatever it is you're doing. If it is reading a newspaper, open it up, open a book, do something active, make notes. This is the way to train our brain. Play Sudoku, Wordle with friends, whatever your medium is. But do not passively consume media. Do not passively consume information. Get out there, be active, use your brain, learn a new skill, go to Ulpan, speak Hebrew. Kamoni. Okay, so I'd like to bring up a case study. This is an actual patient. Obviously, the details have been changed that I worked with in the clinic over the last 6 years. A 60-year-old woman presented to the clinic. She had complaints of forgetting names of family members, friends. Retaining new information was difficult. She read and forgot important numbers that used to be on the tip of her tongue. Her labs revealed something really a shame. Her fasting glucose was elevated. Her cholesterol was elevated. She had low levels of vitamin B12 and D. And upon talking to this patient, it was revealed that she lived an extremely sedentary life. Okay, she had little regular exercise, ate large meals at night, did not limit carbohydrates or simple sugar, and this all needed to change. She felt at such a young age that she was slipping away, and her spouse also was extremely concerned. So we got her on a really solid regime. We started supplementation. Dr. Dinner has 2 proprietary supplements that we formulate. They are called Remag and Remind. Remag is a formulation of magnesium, which is a mineral that is essential for the brain's proper functioning. Remind is a combination of lion's mane, a certain type of mushroom that is essential. It crosses the blood-brain barrier, nourishes those brain cells, allows for proper functioning of the neurons and the synapses. We got her doing regular exercise, supplementation, proper nutrition, limiting technology use at night. I think I should also speak at the GRAS having a technology, Kenneth, I think they asked me. Put down your phone. Proper nutritioning and limiting technology, so improving sleep duration. This patient improved within the year. It was remarkable. From someone who had this deep fear that they were actually losing their life to someone who woke up hopeful, fulfilled, active, they were a different person. It was unbelievable. Her kids, her grandkids were so thrilled to have their bubby back. She was a new person. Okay, so how can we help you? Now I just told you what you need to do. Let me tell you how we can help you. So there's really 3 levels that I like to meet everybody on. The first level is education. You need to know what you don't know. So you need to know, how do I eat? How do I move? What are the right supplements to take? Is my hearing test okay? Should I go get a hearing aid? We need to educate you on all of these different factors. You need accountability. You need someone there to hold your hand. You need someone there to say, this is the way, let me show you, this is where we're going to go. Check in with me after you did XYZ. And that is a really important step, which leads to support. We have ongoing programs where we make sure our patients are supported. They have the supplements they need. They have the diet information. Connect them with the resources they need. If patients come in, oftentimes Dr. Dinner will give me a mission. Find the best shear in the community for this patient. I love it. I feel like one of Charlie's angels. I'm like, I can do it. I'm going to find it. I'm going to find it. So, or give me a task. This patient has an unbelievable knowledge of something random that they're looking for at Hakshiva. Can you get them connected so that they can go volunteer there? No problem. I can do that. So I think that that's part of the support as well. Our healthcare team is made up of a few different people. We are, obviously, Dr. Dinner is our leader. He's running the clinic. His tremendous knowledge in anti-aging and functional medicine is the backbone of our clinic. Myself, I'm the nurse. I'm usually the person that you speak to. Abigail is our office manager. She's going to take care of all the technical details for you, from billing to consent forms to testing to questions, anything you have, she's amazingly available. We have a nutritionist on staff who works with us. Her name is Judy Kaiser, and she specializes not just in nutrition, which is like, woo, a lot. She specializes in functional medicine, nutrition, educating patients, working with them, tailoring diets to what their specific needs are to make sure that they're getting the best. So we are your team. We're there for support. I want to just mention a couple of other things. Dr. Dinner has a new book. It's on the back table. It's called You Only Live Once. They're for sale for 50 shekel. You can see Abigail, myself. We have credit card machine and cash. And it's a comprehensive look at a lot of the information we shared tonight, with a lot more in-depth discussion of lifestyle, anti-aging, supplementation, purpose, meaning, value medicine, which is the foundation of our clinic. Make your life mean something. We don't just want to live a long time. We want to live a long, fulfilled, meaningful life where we are giving to others. We are doing for others. We are sharing. We are building. We are growing. So that is the foundation of everything. You can contact us at the Be Young Clinic to fill out an intake form so we can provide you with recommendations. This is how you get started in our clinic. You reach out to Abigail or myself. We'll send you an intake form. It's extensive. Get a cup of coffee. Sit down. It's going to take a while. It's a lot of questions. We want to get to know you very, very well. We are good listeners. So I want you to fill out this very extensive intake form, and then Dr. Dinner and I will review it together, and he will make some recommendations. Maybe he'll say, you know what, before this patient can even come to the clinic, they need a carotid artery Doppler, or they need an endopat test, or they need blood work, or they need an ultrasound. Really looking at the whole picture, it helps us realize, what are we missing here? What are we missing? So that's essential. And then once that is done, you can book an appointment with us. You start with an intake with Dr. Dinner. It's a very thorough appointment. He'll give you a treatment plan. He'll assess you completely. And then you follow up with me, and we say, okay, how are we going to engage this plan? How are we going to make this work? And that's what we strategize on. Okay. So I'm happy. I really want to just tell everyone that how much I appreciate your participation. I'm happy to take questions about the clinic for myself, for Dr. Dinner. We can kind of go.
What happens with your regular doctor?
Okay, great. Such a good question. Yes. Okay, so we work hand in... Oh, so the question is, what happens to your regular family doctor? So what if Dr. Dinner, you're not lucky enough to be his patient and he's not he's not providing you with your care? Then what we do is we work in conjunction with your family doctor. We always want to use the resources that are available to us in the Kupa first. We'll be happy to give you lists of tests, and you can bring that to your family doctor. And they have tremendous respect for Dr. Dinner and what we're doing, because at the end of the day, family doctors know there is no other solution to Alzheimer's. So, yeah.
There's one thing I would like to say. After Shoshana's talk, how do I join up?
Yeah. Yes. Okay, it's a great question. Do we accept people from outside of Beit Shemesh? We do. We have patients in the United States. We have patients all over Israel. We have Zoom options. People are welcome to come to us. I just want to make one caveat. Patients that are in advanced stages of Alzheimer's, oftentimes the medium of Zoom is extremely difficult for them to navigate. It makes it a little more challenging. That being said, we work it out. We work it out. Okay. Yeah. I'm gonna let Dr. Dinner field that one.
There's definitely a genetic component. The APOE4 gene and the others, which are very crucial and make a person a very much higher risk. We, at this point in time, don't rush to treat it because the truth is, in our philosophy, we only test what we can treat. So if you have to go and do a genetic test and you're living under the awe of having this gene, we don't like that, so it's very stressful, but in the same, you're going to do very similar anyway. So we're not rushing to do genetic testing at this point in time, unless at some point in time the medical fraternity will come up with specific treatment for that gene. Then we'll do it.
Yes. So the clinic is not. This is an adjacent service. Functional medicine is something new here in Israel, relatively speaking. It's not so much anymore, but it is a privately paid service that we use in conjunction. So you always maintain your Coupa coverage with your family doctor, and this is something that you do as an adjunct. Yeah, great question. Thank you. Yeah. Okay, these are great questions. I'm going to start with the last question first. How do you get a family member to come to the clinic? How do you convince them that there's actually something going on? So I think that the best way to begin that is to have a really non-judgmental, open, compassionate conversation. And you can talk about what you see and say, hey, maybe Dr. Dinner has some input in this. Would it be okay if we went together? And then test, don't lie. Oh, not in the country. Okay, maybe can I come with you? Can I come with you on the phone to your family doctor? Can you just kind of phone me into the meeting? And you can say what you see and explain what your concerns are in just a very loving, open, non-judgmental way. Yeah. So in that case, I would say, let's start with this. How about a hearing test, Mom? It's normal. Everyone does it. 50 hearing test. And I think that that's a very non-threatening way to just begin assessing. All of these bloods and things are available. So to your first question and second question, a lot of this blood work is basic blood work that is done via the Coupa. Now, what the range of normal might be is very, very wide. And what the range of optimal is could be much, much smaller. So even though they've had these tests done, having a doctor like Dr. Dinner assess their blood work, I can't tell you how oftentimes people come in, they say, there's nothing red on my blood work, everything's okay, right? I'm like, not so fast, right? Let's really take another look at it and have another doctor kind of assess it and see what's not optimized, what's not the best it could be. As far as the tests that are specialized testing, we are a relatively small patient population here in Israel, only 10 million people. So a lot of these tests require a much larger sample size, so we have to send them overseas to be developed in laboratories there. Did you want to add anything?
Just one thing to add. The whole aspect that Shoshana was speaking about is meant for all of us. We don't have to go to specialized testing. You don't have to come to us. What she mentioned, that whole part, the last part of the talk, we should all be doing. That's a preventive position that we should all be taking and take very seriously because it makes a very, very big difference. Those people who find that there's something more significant, those are the people who should definitely take it further as soon as possible. That's, I think, a message.
Thank you. Are there any other questions? I saw, I think, a few other hands up. Yeah. can you inherit it? That's a very good question. Do you want to speak about inherited the genetics?
Well, it's similar to there is a familial aspect to this, and yes, if one has one or two, definitely first degree relations with it, you have to be much more proactive, definitely.
Are there any other questions? Yeah. Okay, so it's a great question. So in terms of this memory and brain program, there are a few what they call memory clinics here in Israel. These are clinics that specialize in memory and brain health. And I've had patients go to all of them, that they always wanted to go the Western medical model route first. So they went to those clinics and they told the clinic, I'm also working with my family Dr. Dinner doing this protocol and this program. Not one single time have they ever said any part of this is contraindicated. They say, that's great, keep going. You can also come and get your fancy PET scan, and you can also come and get a lumbar puncture if you want, but also just in case, keep doing that thing you're doing with Dr. Dinner. It's never been a problem. Is there anyone? Okay. Thank you all so much for coming. Thank you.